We've never been more medicated, more monitored, more treated, and yet we've never been sicker. What if the very system designed to heal us is part of the problem? There exists within the human body an intelligence so profound, so intricately woven, that no single organ operates in isolation, no system functions independently, no symptom arises without context. Yet somewhere in the evolution of modern medicine, we began to lose sight of this fundamental truth. We started viewing the body not as an integrated whole, but as a collection of separate parts, each one requiring its own specialist, its own protocol, its own pharmaceutical intervention. When your heart struggles, you see a cardiologist who examines your cardiovascular system as though it exists in a vacuum, disconnected from your hormones, your gut, your stress response, your sleep patterns. When your digestion fails, you visit a gastroenterologist who peers into your intestines without considering how your thyroid function might be suppressing your metabolic rate, how chronic inflammation might be originating from disrupted circadian rhythms, how the medications you take for anxiety might be destroying the very bacteria that produce your serotonin. This fragmentation reflects a deeper philosophical error, one born from the mechanical worldview that emerged during the scientific revolution. We began to see the body as a machine, a complex mechanism certainly, but ultimately a system of separate components that could be understood, fixed, and optimized in isolation. And while this reductionist approach gave us tremendous power to identify specific pathogens, to classify diseases, to develop targeted interventions, it also blinded us to the symphonic nature of human physiology. Your immune system does not simply fight infections, it communicates constantly with your nervous system, your endocrine system, your digestive tract. Your gut microbiome does not merely digest food. It manufactures neurotransmitters, regulates inflammation, influences your mood, shapes your immune responses, even affects how you store fat and process glucose. Your mitochondria are not just cellular power plants. They sense nutrient availability, respond to light exposure, communicate distress signals that trigger system-wide responses. When we treat high blood pressure with medication that blocks specific receptors, we ignore that elevated pressure might be your body's desperate attempt to perfuse tissues that are metabolically compromised, starving for oxygen and nutrients due to insulin resistance, chronic inflammation, or mitochondrial dysfunction. We suppress the signal without addressing why the signal exists. When we prescribe antidepressants that alter serotonin reuptake, we overlook that depression might emerge from thyroid dysfunction, vitamin deficiencies, gut dysbiosis, chronic sleep deprivation, or inflammatory cytokines crossing the blood-brain barrier. We adjust one variable in an equation with thousands of interconnected terms, then express surprise when the solution proves incomplete or generates unexpected consequences. This reductionist paradigm creates patients who collect diagnoses like stamps, each condition treated as separate and unrelated, each specialist adding another medication to an ever-growing list, no one stepping back to ask whether these seemingly distinct problems might share common roots in metabolic dysfunction, circadian disruption, nutritional deficiency, or chronic stress activation. The predominant philosophy underlying modern medical practice operates on a simple principle: when something hurts, make it stop hurting; when something elevates, bring it down; when something produces discomfort, eliminate the discomfort. This approach sounds perfectly reasonable on the surface, even compassionate, until you begin to recognize that symptoms are not random malfunctions but rather intelligent signals, messages from a body attempting to communicate that something deeper requires attention. Pain is not the problem. Pain is the alarm system alerting you to the problem. Fever is not the enemy. Fever is your immune system raising its operating temperature to create an inhospitable environment for pathogens while accelerating enzymatic reactions that facilitate healing. Inflammation is not merely destruction. Inflammation is your body's first responder, rushing resources to damaged tissue, isolating threats, initiating repair processes. Yet our medical interventions focus almost exclusively on silencing these messengers rather than listening to what they are trying to tell us. When acid reflux burns your esophagus, you receive proton pump inhibitors that dramatically reduce stomach acid production, providing blessed relief from the burning sensation while simultaneously compromising your ability to digest protein, absorb essential minerals like magnesium and calcium, maintain healthy gut bacteria populations, and defend against pathogens that would normally be neutralized by gastric acid. The symptom vanishes, but the underlying dysfunction that caused your lower esophageal sphincter to malfunction, perhaps due to increased intra-abdominal pressure from dysbiosis or poor carbohydrate metabolism, continues unchecked and often worsens. When your cholesterol rises, you receive statins that block the enzyme responsible for cholesterol synthesis, lowering your numbers on paper while ignoring that cholesterol elevation might represent your liver's response to chronic inflammation, hormonal imbalances, thyroid dysfunction, or insulin resistance. You've suppressed the marker without addressing why your body deemed it necessary to produce more cholesterol in the first place, and in the process you've interfered with the production of coenzyme Q10, a critical molecule for mitochondrial energy production, potentially compromising muscle function, cognitive performance, and cardiovascular health in ways that won't appear on standard lab tests. When anxiety floods your nervous system, you receive medications that dampen neural excitability, creating a chemical cushion between you and your distress, while the root causes, perhaps chronic blood sugar instability creating adrenaline surges, perhaps gut inflammation producing cytokines that cross into your brain, perhaps circadian disruption preventing proper cortisol rhythm restoration during sleep, remain completely unaddressed. The suppression paradigm creates a peculiar trap where patients feel simultaneously better and worse, relief from immediate symptoms masking progressive deterioration of underlying function. Blood pressure medications lower your numbers while your vessels grow stiffer, your insulin resistance deepens, your kidneys adapt to reduced perfusion pressure. Anti-inflammatory drugs quiet your pain while your gut lining erodes, your liver processes mounting toxic loads, your body's natural healing responses grow increasingly dysregulated. Sleep medications force unconsciousness while preventing the deep restorative stages where your brain cleanses itself of metabolic waste, where your immune system recalibrates, where memories consolidate and emotional processing occurs. Modern medicine operates at a velocity that would have bewildered physicians from any previous era in human history. A patient walks into an office, describes symptoms that may have been developing for months or years, and within 15 minutes receives a diagnosis and a prescription, the entire complex mystery of their suffering reduced to a diagnostic code and a pharmaceutical solution. This acceleration reflects our broader cultural impatience, our technological expectation that every problem should yield to immediate intervention, but it also represents a profound loss of something essential to the healing arts. There was a time when physicians understood that the body speaks slowly, that patterns emerge only through careful observation over time, that healing itself is a process that cannot be rushed without consequences. Your body operates on timescales that modern medicine no longer respects or even acknowledges. When you sustain an injury, there exists a carefully orchestrated sequence of cellular events. Inflammation arrives first, clearing debris and preventing infection. Then proliferation begins, building new tissue. Finally, remodeling occurs, strengthening and refining the repair over weeks and months. Interrupt this sequence with premature interventions designed to speed recovery, and you often end up with tissue that appears healed but lacks proper structural integrity, setting the stage for chronic problems years later. When your gut microbiome suffers disruption from antibiotics, stress, or dietary insults, restoration requires not days but months of careful tending, allowing beneficial species to recolonize, compete for resources, establish stable populations, train your immune system to tolerate their presence. Yet patients and physicians alike grow frustrated when improvement doesn't manifest within weeks, abandoning approaches that simply needed more time to work. The healing intelligence within you operates according to circadian and seasonal rhythms, hormonal cycles, metabolic feedback loops that unfold over days and weeks, not minutes and hours. Your thyroid doesn't shift its output instantaneously when you introduce supplemental hormone. It takes weeks for your pituitary to adjust its signaling, for your cells to alter their receptor sensitivity, for your metabolism to find a new equilibrium. Your nervous system doesn't recalibrate overnight when you begin addressing chronic stress. It requires repeated experiences of safety, thousands of small moments where your body learns that the emergency has ended, before your baseline arousal state gradually shifts. Yet in our haste to fix everything immediately, we often introduce interventions before we've even properly understood what's happening, stacking treatments before the first one has had time to reveal its effects, adjusting medications before we've observed how the body responds over complete hormonal cycles or seasonal transitions. This impatience also blinds us to the body's remarkable capacity for self-correction when given appropriate conditions and sufficient time. A fever allowed to run its course often resolves infections more completely than premature suppression. Acute inflammation permitted to complete its cycle frequently results in more thorough healing than aggressive early intervention. Symptoms that wax and wane over weeks often reveal patterns that point toward root causes, patterns that become invisible when we immediately suppress whatever feels uncomfortable. We've lost the wisdom of watchful waiting, the art of discerning which symptoms require urgent intervention and which ones represent the body's intelligent work in progress. There exists a peculiar and troubling phenomenon that lurks within the very heart of modern medical practice, one that physicians whisper about in hospital corridors but rarely discuss openly with patients. The treatments meant to restore health can themselves become sources of illness, creating new disorders that require additional treatments, which in turn produce their own complications, spiraling outward in ever-widening circles of intervention and consequence. A woman develops insomnia, perhaps initially triggered by stress or hormonal changes, and receives a prescription for sleep medication that does indeed help her fall unconscious each night, but this chemically induced state prevents her from entering the deep sleep stages necessary for proper lymphatic drainage in her brain. Over months, metabolic waste accumulates, cognitive function begins to decline, anxiety increases, and she now requires additional medications for the anxiety that her sleep medication partly created. The anxiety medication affects her digestion, slowing gastric motility, altering gut bacteria populations, leading to bloating and reflux, prompting a prescription for proton pump inhibitors. These drugs, by reducing stomach acid, impair her absorption of magnesium, and magnesium deficiency worsens her sleep quality, increases muscle tension, elevates anxiety, and contributes to insulin resistance. Her blood sugar begins to climb, her weight increases despite unchanged eating habits, and now she's facing a diagnosis of prediabetes. Each intervention seemed perfectly logical in isolation, each prescription addressed a legitimate symptom, yet the cumulative effect has been a cascade of deteriorating health, a patient who entered the medical system with a single problem and emerged with 5 interconnected disorders, each one treated separately, none of them traced back to their iatrogenic origins. This pattern repeats itself millions of times across modern healthcare systems. Antibiotics given for respiratory infections destroy beneficial gut bacteria that were producing vitamins, regulating immune function, protecting against opportunistic pathogens. Within weeks, the patient develops recurrent yeast infections, small intestinal bacterial overgrowth, new food sensitivities, chronic fatigue. Corticosteroids prescribed for autoimmune conditions suppress immediate inflammation beautifully while simultaneously inducing insulin resistance, bone density loss, adrenal suppression, immune vulnerability. When the patient develops osteoporosis, high blood sugar, and recurrent infections, these are treated as new, unrelated conditions rather than predictable consequences of the original treatment. Chemotherapy destroys cancer cells along with the rapidly dividing cells in bone marrow, gut lining, hair follicles, creating anemia, digestive devastation, immune compromise that persists long after treatment ends. Radiation damages not just tumors but surrounding tissue, blood vessels, creating scarring and dysfunction that may not manifest for years. These consequences are known, expected, often deemed acceptable trade-offs, yet patients rarely understand the full scope of what they are inheriting. Perhaps most insidious are the subtle, cumulative effects that never get attributed back to their pharmaceutical origins. Statins depleting coenzyme Q10, leading to muscle pain, fatigue, and cognitive difficulties dismissed as normal aging. Antidepressants blunting emotional range, flattening motivation, disrupting sexual function in ways that erode quality of life and relationships. Blood pressure medications causing erectile dysfunction, fatigue, depression, each symptom addressed with yet another medication rather than questioning whether the original intervention might be reconsidered. The human body emerged over millions of years in intimate relationship with its environment, shaped by the rhythms of day and night, the cycles of seasons, the quality of soil and water, the presence of beneficial microorganisms, the necessity of movement and occasional scarcity. Every cell in your body carries ancient expectations, evolutionary assumptions about the conditions under which it will operate, and when those conditions are met, something remarkable happens. Your biology simply works. Mitochondria produce energy efficiently, inflammation resolves appropriately, hormones synchronize with environmental signals, repair mechanisms activate during rest, detoxification pathways clear metabolic waste, and your immune system distinguishes friend from foe with precision. This is biological coherence, the state where all your systems align with their design parameters, and it represents the foundation of genuine health that no pharmaceutical intervention can replicate. Light exposure provides perhaps the clearest example of how environmental alignment governs physiology. Your circadian clock, seated in the suprachiasmatic nucleus of your hypothalamus, expects bright blue-rich light in the morning to set your daily rhythm, signaling your entire body when to wake, when to release cortisol for energy, when to optimize digestion, when to prepare for activity. As evening approaches, it expects the warm red spectrum of sunset, triggering melatonin production, shifting metabolism toward repair mode, preparing every organ system for the deep restoration that occurs during sleep. Yet modern humans bathe in artificial blue light until midnight, sit in dimly lit offices during daylight hours, confuse their ancient timing systems so profoundly that cortisol peaks at wrong times, melatonin never properly rises, growth hormone pulses diminish, and chronic disease risk escalates across every system. No medication can substitute for the simple act of watching sunrise and limiting evening light exposure. The food you consume either supports or undermines metabolic coherence with equal power. Your cells evolved expecting whole foods, nutrient-dense packages where vitamins, minerals, proteins, and fats arrive together in ratios that support enzymatic processes, cellular signaling, membrane integrity, and energy production. When you eat processed foods engineered for shelf stability and profit margins, stripped of micronutrients, loaded with industrial seed oils that incorporate into your cell membranes and alter their fluidity, spiking blood glucose and insulin in patterns your pancreas never evolved to handle repeatedly throughout the day, you create metabolic incoherence. Your liver struggles to process the overload, storing excess as fat, becoming insulin resistant, producing inflammatory signals. Your gut bacteria, expecting fiber and polyphenols, starve and produce endotoxins. Your mitochondria, flooded with more substrate than they can process, generate excessive reactive oxygen species, damaging their own DNA. Movement, social connection, exposure to natural microbiomes, periods of fasting that allow cellular cleanup processes, contact with earth and water, time in nature where your nervous system can recalibrate. These are not optional lifestyle enhancements but fundamental requirements for biological coherence. A body in alignment with its evolutionary context possesses self-healing capacities that dwarf what any intervention can achieve, and the path toward genuine health begins not with adding more treatments but with removing the obstacles, restoring the conditions under which your remarkable biology can express its inherent wisdom.